Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 5 starts now.
Radar still lighting up at 5 o'clock, but it's rain and not snow. Now the next question is, can we warm up for the weekend?
The governor is holding her ground on not putting new restrictions into place during this latest COVID surge. Coming up, we take a look back at what was different then and now.
And we're going to begin with the coronavirus surge. Local hospitals issuing dire warnings today as 6,303 new cases are confirmed over the past 24 hours. State also reporting another 112 new deaths. That includes 81 that come from a review of past vital records. We're glad you're with us today at 5. There's no sugarcoating it. The entire state, and especially Southeast Michigan, seeing an explosion of COVID cases again.
Local hospitals are reaching capacity with staff stretched to the limits, and tonight they're pleading for help that only we can give. Local 4's Rod Maloney is live tonight. Rod, these doctors and nurses are tired and they're afraid of what's to come.
Right, and that's the larger issue. But, you know, here's the thing. They're calling it the perfect storm. It's a cliche, but there's a good reason for that. It's impactful. They're saying that they're at between 90 and 95% capacity, which is essentially in a hospital full with COVID patients. And they don't want to reduce other surgeries and the like. And so now they're getting deeply concerned.
I'm framing this as a community call to action.
That's Dr. Nick Gilpin, the infection disease medical director at Beaumont, saying it's bad and getting worse inside the System's 8 hospitals.
We are seeing a younger patient population. And along with that, we're not seeing necessarily as severe of disease overall, but don't mistake that for the fact that we're seeing less severe disease. We're still absolutely seeing incredibly sick patients.
Right now, Beaumont has roughly 800 COVID patients. At the worst of it last year, they had 1,300. Henry Ford tonight is reporting 550 COVID patients and had roughly 900 at the worst of it last year. Chief Operating Officer Bob Riney said in a briefing today,
"We are feeling a great pressure point, and right now we are able to accommodate because with the treatments getting better, we're able to reduce the length of stay, so we are able to move patients in and then back out of the hospital for home care and follow-up treatment quicker than we could before."
Still, that optimism is waning quickly. Beaumont Chief Nursing Officer Susan Grant says,
"It literally is an all hands on deck, and people are willing to step up and do what they need to do, but we need help. We need to know that everybody's doing their part."
And so they got people working extra shifts. They're moving people around as they had done a year ago, and they are doing their darndest to try and make sure that the hospitals can handle all of this. The problem is that they're about 2 weeks away from a real severe problem. And on that, we're going to be taking a look at Local 4 News at 6 o'clock at precisely the problem that is going to be there. And it has to do with staffing. Reporting live in Royal Oak, Rod Maloney, Local 4.
Rod, thank you. We want to turn now to Dr. Frank McGeorge, who's witnessing what's happening firsthand inside the ER.
And Frank, I know you are extremely concerned right now.
Absolutely, Kim and Devin. You know, every single week, the state puts out new data on different aspects of the pandemic that I study religiously. Now, we all know new cases have been increasing steadily, but the newest data released from the state now shows that statewide, hospitalized patients have now officially exceeded the last winter surge. Now, that by itself is concerning enough, but focusing specifically on right here in Southeast Michigan, we have the highest rate of hospitalizations compared to the entire rest of the state. And we have the greatest increase in COVID patients requiring ICUs. Here's the thing, the state of Michigan, we have a COVID problem. Here in Southeast Michigan, we have a COVID catastrophe. I don't know how else to say this. It's just really bad. Now, the concerns you're hearing from hospitals in Southeast Michigan are because we are legit in trouble. This is not some future forecast. Southeast Michigan is in a COVID storm right now. So everyone, please, just wear a mask. Avoid unnecessary public contact. Stay home when you can. And please just get vaccinated. And I mean it seriously. If everyone voluntarily does their part, we can minimize the pain.
So the question here, I guess, remains, can we vaccinate our way out of this, Frank?
No, not anytime soon. Look, the vaccines are really essential, but we have a more pressing short-term problem right now that the vaccines will not get us out of. Vaccinations will take weeks to slow the spread. We don't have weeks. We need it slowed right now. And that's why you keep hearing these appeals to everyone to take this seriously and do our part.
And Frank, one other matter here. For those who have been vaccinated, we still don't actually know whether or not you still have the ability to pass on the virus to someone else, right? Even though you may be protected against it.
Well, that's exactly right. With this high rate of community transmission, there is a risk that even vaccinated people could acquire and pass it on. And that's why we still need the community mitigation for everyone, vaccinated or unvaccinated.
Yeah. All right, Frank.
Hospitals are overwhelmed and worried about what could still be coming. Despite that, though, Governor Whitmer has refused to issue any new restrictions.
So those restrictions in the first waves were put in place to try to keep Michigan's hospitals from going through what looks to be happening right now. And this time the numbers are just as bad, and as we've just showed you, getting worse. Grant Herms has been looking back at the governor's past reasons for shutting things down and the argument that she and others are making that this is different this time. Grant?
Well, Kimberly, Devin, things have changed over the course of the pandemic, like what we know about how the virus spreads, the treatments, and of course the vaccines. But there are some striking similarities between what's happening now and back then, starting in March of last year.
This will be temporary. This intervention is important to buy time so we can create surge capacity in our hospitals.
Just 10 days later, Michigan would hit its first daily case peak of just under 2,000 cases. 7 months later, Michigan was heading into the holiday season, and cases began a steady rise into the thousands each day. After a summer and fall of political fights, threats, and a lack of compliance with social distancing, the governor, citing science and national models, called again for more restrictions.
These steps are what the public health experts say we must take to avoid overwhelming hospitals and death counts like we saw in the spring. The rapid spread of this virus requires that we take aggressive action now to save lives.
Just 5 days after that, Michigan would have its highest daily case count of the pandemic, 9,779 cases. Michigan's late 2020 pause has been widely praised, and at least one study from Imperial College said it helped save thousands of lives. But as the state creeps towards that record case count, the governor has changed course, opting instead to lean on vaccination, therapeutic treatments, and calling for more personal responsibility, despite similarities to the spike in the fall.
Instead of mandating that we're closing things down, we are encouraging people to do what we know works. That's the most important thing that we can do. It's not the policy problem, it is a variant and compliance problem.
But the health experts don't agree. The heads of the NIH and CDC saying Michigan will not be able to vaccinate its way out of this latest spike.
Close things down, to go back to our basics, to go back to where we were last spring, last summer, and to shut things down.
And hospitals with a warning today that personal responsibility may not be enough.
I think that the people who are going to do the right things are already doing the right things. And the people who are not doing the right things will not do the right things. And so I think some of that is preaching to the choir, unfortunately.
So, Grant, the question a lot of people are asking then in all this is why?
Well, Devin, frankly, we just don't know. What we do know is that the White House said they're not going to play whack-a-mole and send more vaccinations to states that are hotspots like Michigan is right now. We also know that the governor, for the first time, her favorability numbers dropped below 50% last month, as a lot of folks are looking ahead to that election in 2022. What we do know is the things that work, all the stuff we just heard Dr. Frank George talk about. But the question now really is, are people going to do those things? We'll have to wait and see.
Yeah, absolutely. All right, Grant.
A third dose of Pfizer's coronavirus vaccine will likely be needed within a year. Pfizer's CEO says people will likely need a booster shot within 12 months of being fully vaccinated. He says it's possible people will need to get vaccinated against the virus annually.
Well, we've been dodging the rain on and off all day, it seems.
That's right. We see sun 1 minute, rain the next minute. I could have sworn I saw some freezing stuff out there, too. A real Michigan kind of day, actually, Ben.
You probably did, Kim. We had reports of snow. We had reports of grapple, those little frozen pellets of water earlier today. But just as you said, we've got some dark clouds. We've got a little bit of blue over the downtown Detroit right now. But look at those temperatures, mid to upper 40s, by far our coldest of the forecast. Things are going to improve starting tomorrow, just maybe not as fast as some of us would like. Here's Storm Tracker 4, and you can see that there's still a little bit of stuff out there. It's mostly on the east side. We're watching this area to see if it sort of expands. Models are suggesting that it may, so we may be seeing showers at least through the evening hours. Otherwise, we're going to be dry overnight, and temperatures will be down into the 30s shortly after midnight. So we'll look at temperatures for the weekend and how much of Saturday and Sunday is going to be wet as well. All that in just a few minutes, guys.
Okay, Ben. Testimony has ended now in the trial for the Minneapolis police officer charged with murdering George Floyd.
Derek Chauvin told the court this morning he would not take the stand in his own defense.
I will invoke my Fifth Amendment privilege today.
Shortly after that statement, the defense rested its case. They only took 2 days for testimony compared with 2 weeks for the prosecution. Closing arguments begin Monday. Then the jury will be sequestered until they make a decision.
If I were you, I would plan for long and hope for short. Basically, it's up to the jury how long you deliberate, how long you need to come to a unanimous decision on any count.
In anticipation of deliberations and a verdict, security is being stepped up in the city's downtown. Some businesses have started to board up their windows and doors again.
We've got much more to come today. Let's check in with Hank.
Mail delivery a problem in your neighborhood? You're not alone.
Since the pandemic, I have really noticed an increase of not receiving mail.
Coming up, Help Me Hank investigates and shows you what you can do to get the mail back in your mailbox.
I got home, I found the police officer at the house who explained to me what happened.
For 5 years, it's been this father's mission to stop distracted driving.
You might as well be, blindfolded.
After his son died after being hit by a distracted driver. His story and push for change coming up.
It was a heated situation on Detroit's west side overnight. A father, a mother getting into a fight. A 7-year-old girl is shot over it. She's going to be okay, but this renews a much bigger and much more important conversation.